It's great to bring the parties together and to generate the mixing of all the different elements in the healthcare sector, from the policy people and the provider space and the payer space. And as you know, Southern California is a unique ecology, so it's important that we bring people together in this complicated space.
I came to the state of reform to really hear what's going on across a variety of states, but in particular California, and really just think it's a great opportunity to be kind of at this intersection in healthcare, which includes everyone from private companies to policy experts to government.
I think what intrigued me about it was that it was a conference generated by people, and you went out and you did a great job of asking people what they thought was interesting and then who they want to hear from. You went to where the issues are and you went to where the people are.
It was a really good intersection of ideas and trying to understand different perspectives. And so far, all of the sessions that I've seen have been that mix and have been really thought-provoking.
I think how we are going to work together between the government, plans, providers, and any other entities, I don't think we have the final formula yet, but there are certainly plenty of experiments going on.
It's always useful to get in touch with other folks doing the work of implementing health reform and making sure that California not just implements but improves upon it so that people get the best possible care at the best possible price.
I think there's a sense of urgency that we need to continue to promote. That is, yes, things change slowly, but you really still need to drive, I think, very aggressively at what we're trying to get at, which is making the dollars that are in the system work for patients, work for families, work for communities.
It's the last year of the phase-in for the ACA, and so we're watching really closely. Can the individual market, can covered California, and can the plans in California really reach out to the remaining population and get them insured?
Reforms are coming at us, sort of in a tidal wave as we are moving forward with the baby boomer population, the need for, more long-term care, the expanded Medi-Cal population. So there's a ton of reforms coming at us, but really just trying to think about what's best for the consumer as we are moving through these reforms.
Health care and health coverage are really about human beings and basic human needs. And I just think it's incredibly important to stay focused on our goal here of trying to make sure that people have health coverage and access to health care so that they and their families can be the healthiest they can be, so then they can really live their life the way they want to, work on their dreams the way we would want for anybody. But we all know how precious health is, and I think sometimes it's just really worthwhile to sort of come back to that focus.